Welcome back. Today I'm joined by Dr. Matthew Siljander, who is here on behalf of Hoag Orthopedic. Well, Dr. Siljander, thank you for joining us. Welcome.
Thank you for having me.
So we were talking a little bit offline about different types of surgeries that you do, but you primarily focus on the reconstruction of joints of hip and knee. Tell me a little bit of background on that.
Yeah, so basically, let me just start out briefly to give you a little background on myself, and then we'll kind of jump to background hip and knee replacement. So I'm originally from Phoenix, Arizona, a nice hot desert place, and then I spent a lot of time before coming out here in a much colder place, which is the Midwest. I did all my training out there. I went to University of Michigan for undergrad and studied mechanical engineering, and I actually worked as an engineer for a couple of years before going back to medical school. I went to medical school in Chicago, at Chicago Medical School. Mm-hmm. After that, I went back to Michigan at Beaumont Health for my orthopedic residency. And then following that, I went to an even colder place. I went to the Mayo Clinic in Rochester, Minnesota. And that's where I specialize in knee and hip replacements and kind of advanced reconstructive techniques, redo surgeries of hip and knee replacements. And, there's a lot of new things kind of happening in knee and hip replacement surgery, but there's also a lot of things that have stood the test of time. There's various changes to implants that have been done to the hips and knees, but a lot of the same principles are still the same. I think one of the biggest things that has happened somewhat recently is, the multimodal pain medication. Before in the past, a lot of people used to be on a lot of narcotics, heavy doses of narcotics, and then not much else. These days, you still have some form of narcotics after, hip or knee replacement surgery. This is mixed with other medications to kind of offset the burden of that, Tylenol, Tramadol, sometimes other anti-inflammatory medications. So you take smaller doses of various things, and that not only does that require less opioid use, but it also has better pain relief overall. And additionally, more recently, there's been a lot quicker trend to doing some of these surgeries in an outpatient setting. Whether this is done in a hospital where you go home the same day, whether it's done at a surgery center where you go home the same day. That's being seen more and more as these surgeries are able to be done on a more streamlined basis.
Okay.
That's obviously not for everybody, but it's becoming more and more prevalent these days.
Wouldn't that depend on potentially the recovery, like what kind of recovery they would have to do?
To some degree, yeah. So a lot of it kind of depends on, the patient's overall health, medical health, and, whether they will be safe to kind of go home the same day. And that, to be honest, that's a larger and larger population of patients. And that determination is kind of made, in conjunction with your surgeon, before surgery, because and sometimes the nice thing about a hospital setting is for those patients that, may need an extra night in the hospital, you have that opportunity in a hospital setting, whereas if you're at a surgery center, you don't. But then there's plenty of people pretty much guarantee that they're going to be able to go home the same day, and that's becoming more and more common. So it depends on the medical health of the patient, kind of how well you are functioning beforehand, and kind of how well you're expected to be able to function after surgery. That kind of ties in a good thing you mentioned about recovery. Recovery being physical therapy after surgery. There's different approaches to what physical therapy you should or shouldn't do, or you need to do after surgery. I think for knee replacements, most people are, getting physical therapy after knee replacement surgery. For hip replacements, a lot of people are as well, but it's more common to not get physical therapy after that. Mm-hmm. Interestingly, at the Mayo Clinic, there's some surgeons there who don't do physical therapy basically after a hip or knee replacement surgery, because they feel that, to some degree, sometimes patients are their own best physical therapists, where they learn the exercises in the hospital or in the surgery center before they leave, and they do those at home. And only at the 2-week mark, if you're not progressing as well as you need to, then you can start physical therapy. But this is kind of an individualized process, not really a cookie cutter kind of thing.
So you primarily are doing knee and hip replacements. So compared to Minnesota, I'm sure you see a lot more here in California.
Well, it's kind of a growing need across the country as the baby boomer population is aging. There's more and more people requiring knee and hip replacement surgeries, in Minnesota, here, and so really anywhere you are in the United States, there's a lot more people that are kind of needing it. And
Right.
knowing when the right time to get a joint replacement is really an individualized decision. It can be a hard thing. A lot of people that have a joint replacement, once they get it done, they say, "Oh, I should have done this a long time ago." But it's a hard decision. It's a big decision, and you don't make decisions just based on what you see on X-rays. You obviously have to have the arthritis there to be a
Right.
candidate for a joint replacement surgery. But that's not the be-all end-all decision. Really, it depends on how you're feeling. So the question to ask yourself is your pain, is your quality of life, and is your activity limited significantly enough because of your arthritic pain you want to undergo an operation? If the answer to that question is yes, and your arthritis is there, well, that's the right time.
I guess I was assuming that you would see more here in California based on the fact that we have better weather. So we're probably outside a lot more. We play a lot of tennis, we play a lot of golf, we do a lot of things that really require quite a bit of movement, not, regardless of our age. However, for my community, which is 55 and over, they are very active and they like to dance and they like to do all fun
Yeah,
things.
right.
So I'm imagining that, at some point you get the arthritis, you're like, oh man, I can't dance anymore.
Well, people have asked me before, after I have the surgery, am I going to be able to dance? And my question to them is usually, were you able to dance before? Because if you weren't able to dance before, well, probably not going to be able to dance afterward.
That's a good one. All right, awesome. And then before we started talking, we were talking a little bit about some advancements, and you were mentioning navigation. Tell me how navigation is used.
There's a variety of different. There's a big spectrum of navigation. There's the highest end of it is robotics, and then there's various levels of navigation kind of going down from there. And the idea is to get the position of the components, whether it's in a hip placement surgery, whether it's like acetabulum or the cup part of the surgery, or the femur part, or in the knee, the part that goes on the thigh bone, or the femur, or the tibia, or the shin bone, and getting those exactly where you want. So that's kind of the idea is to kind of using different tools to optimize positioning of your components.
Okay.
And so in general, when they've looked at studies comparing navigation to not using navigation in kind of a whole cohort of patients, the biggest difference so far is what we call radiographic outliers. It sounds like a big term, but basically what that means is on X-ray, you see various positioning of implants, some kind of this way or that way, or most of them are about the same. So a navigation system reduces those ones that are kind of on the outskirts and brings them all to be about the same. So that's kind of an uncommon situation. In terms of the most important thing, which is clinical outcomes, how do patients do after these surgeries with navigation? How do they do without navigation?
Mm-hmm.
To date, most of the studies have showed that both ways do about the same. There's been a lot of talk recently in terms of hip replacement surgery with patients that have also back disease or arthritis or fused spines, and what's the proper positioning of the cup, in those patients. And I think once there is a way to develop a hard target where you would say, for example, I want this cup at exactly 42 degrees or rotate exactly this number of degrees,
Mm-hmm.
then I think a navigation system will be much more useful for hip replacement when you have a very specific target. But when you know you want to get it to a certain target within plus or minus 5 degrees, you can do that without navigation. And navigation creates additional costs. There's a couple of small incisions and those which those aren't really that big of a deal. But when it's not 100%, when it's not showing that it's necessary, then not every patient requires it. And so what I would caution people in general about is there's a lot of marketing that goes into various things in joint replacement surgery, and really, I mean, all across the medical field and even outside of the medical field. So these are all very important questions when you see your surgeon. If it's me or if it's somebody else, talk to your surgeon. If you have questions, bring them up. It'll be, you can have an open dialogue, so you can have the best thing done that's good for you. you.
Well, and I understand that Hoag Orthopedic is doing more joint replacements than any other hospital in California. So that's amazing. And you're now part of that. Tell me what you like about Hoag Orthopedic.
I think it's a great group of people. I mean, from the surgeons to the operating room staff to the nurses to physician assistants. It's a very cohesive group. Everybody has the same goals in mind, and that's to do the best by the patient. And everybody has a common goal. There's not a lot of pushing one way or the other. So that's been probably the best thing I've noticed and really appreciate about Hoag Orthopedic Institute.
That's awesome. And that's probably why you guys got the 2021 best hospitals on the best hospitals list. So congratulations.
Thank you.
Well, I really appreciate you taking the time. I know you're on your way to more surgery. So have a great day and thank you for spending time with us.
Yeah, thanks for taking the time to talk to me, and I'm happy to help, answer any questions you guys have down the road as well.
Okay, great. Thank you very much.
Thank you.
And we'll be right back after this.